Yeah, so we came to CARP today just to tell them a little bit about our programs at O'Brien House.
During Recovery Month, we have to acknowledge that recovery looks like many different things for many different people.
For children and adolescents, we also do psychiatric medication management.
Being Recovery Month, I suggest have a conversation with your kids.
For the National Recovery Month, it allows us more awareness to bring to the public.
We are a Capital Area Reentry Program, and I serve as the Executive Director. Here at this location, we service the harm reduction side of the community for people who inject drugs and people who use drugs. So we operate a Be Safe Syringe Service Program, allowing people to get safe. We take pride in our mobile force, our mobile teams that are out in the community in high prevalence overdose zip codes, rural areas. And so we just want to inspire everyone to keep continuing on their journey and never give up and be safe while doing it.
So right now, what we're doing is we're assembling tie kits. And what a tie kit basically is, it's gonna be alcohol pads, a tourniquet, which is a tie off, it's gonna be cotton, and it's gonna be a clicker. Any type of drugs, whether it's insulin, whether it's an illicit drug, or otherwise hormones, we like to provide that. And that is so that we can reduce the transmission rate of HIV, HCV, and syphilis, because those numbers keep going up, especially syphilis. So anybody can come here. We don't send you through 1,000 questions. We just want to make sure you have what you need to stay as safe as possible, to reduce as much of your harm as possible as you take your journey into recovery or whatever it is you may be. We just want you to be as healthy as possible.
I'm the director here at Children's Behavioral Health Services of Capital Area Human Services. We do individual therapy and counseling, family therapy and counseling with children and adolescents and their families. We also do psychiatric medication management as needed. Well, Mr. Charles Dennis is a licensed professional counselor with many years' experience working with teenagers and even children. He heads our EIP, which stands for Early Intervention Program, which focuses on identification and treatment of early substance abuse concerns or early addiction concerns. So he does some early intervention, and he also does direct treatment with regards to substance use and substance abuse.
I provide mental health as well as substance abuse counseling. One of the challenges today when it comes to educating the children regarding marijuana use is that they get a lot of miseducation. Miseducation from their peers, what they see on social media, at least watching it on TV, because it's much more prominent now than ever before. And for the parents, if you are concerned or think that your child may be using any type of substance or alcohol, please bring them over to Capital Area. We'll do an assessment and check out their needs, whether it's for behavioral health or substance abuse treatment.
And here at Capital Area, in my role, I am first point of contact for individuals who walk into this clinic who are seeking ARS services. Once I meet with them, we do an assessment, we determine what their needs are, and from there, it's either referral to one of our many programs that Capital Area offers. It could be IOP, which is intensive outpatient therapy. It could be a referral to our inpatient facility known as CARP. It can be a referral to our MAT program, which is our medically assisted treatment program that provides medication for individuals who are struggling with opioid and or alcohol addiction. Time we get to either honor or recognize those individuals who are putting in the work and putting in the effort to change their lives. We have the opportunity here at Capital Area to make an impact on these people's lives. Many people that don't struggle with addiction don't quite understand the work that has to be put in order for people to recover. So I always tell people, when you don't understand something, just learn about it. And that's the purpose of National Recovery Month, where we teach people, we educate people on what recovery is. And not only that, we honor those who still put in the work, because people do recover. And recovery happens every day at Capital Area.
I'm a licensed clinical social worker. I work for Addiction Recovery Services at both the Wooddale location and at Ascension location. Here at Wooddale, I do a lot of work with Women's Recovery IOP. Ascension Project, however, is quite new. I'm very excited about that. Previous to that, the Ascension location did not offer ARS. For National Recovery Month, I think the main thing we need to have out there is letting people know, yes, addiction is real. Everybody knows that. But I want them to also know that so is recovery. Help is available. There is hope and encouragement, and we just want to get people in and help them get better.
We at Capital Area are here to help the public, help anybody that is willing to come and see us. We have an open door policy and process. You can walk in at any time. That we're open from 7 a.m. to 6 p.m. Come and talk to our staff. We have clinicians, we have psychiatrists, we have nurse practitioners that are here and will listen to you and provide you with all the help. I would say that we should bring more awareness to the public. We should talk more to people. We should take our recovery to every place, the churches, homes, families, wherever we can talk to people about recovery. That way we can help more people.
I think recovery is all about family, right? And so at O'Brien House, we believe in family. We're family oriented from the staff to the clients. When our clients graduate, we tell them 3 things that they have to remember. Keep God first, so thine own self be true, and you'll always have a family at O'Brien House. And as a staff member, I've seen that with my coworkers, I've seen that with the clients, and especially continuing on to IOP, they continue to come back and keep their counselors abreast of what they're doing. So it's all about those external motivators. You're gonna have hard days, but remember, you've been through tougher days, and there's always a light at the end of the tunnel, and tomorrow will always come. And keep your head up. You've been through tougher and you can do it.
Today, we bring a close to National Recovery Month. We've had a number of activities this month involving our community partners and a number of our staff members who participated in activities. We want everyone to know their recovery is important. We want people coming through the doors to feel safe. We want them to know that they are welcome and their recovery is possible.